I think like when we first found out that our baby was diagnosed with cleft, we were actually quite shocked because nobody in the family history has cleft and we know nothing about it, to be honest. So we were very, very worried at that point. I think I remember once we did the first scan, we actually broke down quite a fair bit.
When we also first met Josephine, she was very assuring because that was the first time that we felt that there was a solution, fully reassured that we're in good hands.
In cleft palate babies, the abnormal palate muscle inserts into a eustachian tube. This leads to fluid accumulation in the middle ear, resulting in hearing loss. As ENT surgeons, we put a very small ventilation tube into the middle ear that is meant to stay for a while and restore hearing. We try and combine the surgery with our plastic surgeon colleagues in their repair of the palate or the lip to save the patient a second surgery.
A cleft lip repair helps the babies to feed normally and speak normally. Of course, it also helps to restore a normal appearance. We do this usually by cutting around the cleft edges, dissecting the muscle and repairing it together.
When we first found out that Oliver has a cleft, it really wasn't easy. It was nothing that we have expected. It was really a one-stop shop that we are able to get advice from a doctor and of course the administrative and financial advisors from the coordinator as well. Wasn't easy really, but we are first parents before anything else. Being our first child, it was so difficult and we really were worried and anxious, but at the same time excited as well for the outcome.
We envisioned him to be slightly different from how we thought he would look like. It was like there was this sense of familiarity, but at the same time, it was slightly different from how we envisioned him to be.
I teared up a little bit.
I was very emotional. We are also really grateful to the nurses because they actually taught us how to do the proper cleaning for Oliver's wound so that there would not be any infection.
Really, but most importantly, we knew that we're not alone.
First, we raise the pink tissue off the hard palate like this. We also dissect the soft palate muscles out like this so that they can be repaired in the midline to aid in speech. Finally, we also close the pink tissue towards the midline like this.
We first see our patients at 6 months of age to provide weaning advice. We also advise them on appropriate milk bottles for cleft palate. As the child continues to grow to adulthood, we monitor their language development and listen for any abnormal speech patterns associated with the cleft. We are the only center with such specialized investigations for cleft speech, such as the speech video fluoroscopy and speech nasendoscopy. This will be useful when abnormal speech patterns are observed, such as air escaping through the nose or sounding nasal when they speak.
I have been coming for speech therapy since I was 6 months old. I love coming for speech therapy as I get to play games and read with Dr. Selina.
We use this mirror and count our teeth. Okay? Okay. If your child has a cleft lip or palate, taking care of their teeth needs extra attention. This is because children with cleft condition may face some dental challenges as they grow. They might have differences in how their teeth develop, including the number of teeth, their shape, or how they come through. The way their jaws grow may also be affected. We recommend bringing your child to see us when the first tooth erupt or latest before their first birthday. Our pediatric dentist will carefully check your child's mouth and create a care plan that is just right for them, working closely with other specialists like orthodontists when needed. We'll also give advice about toothbrushing and a healthy diet. Most importantly, we want to make dental visits a positive experience for your child. By starting early, we can help them develop good dental habits that will last a lifetime.
Hi, I'm Dr. Koo, the orthodontist. My role is to prepare the teeth and jaw in time for the alveolar bone grafting surgery. We will use braces to widen the maxilla, to align the teeth, and to prepare the cleft area for the surgery. The braces treatment will last for about 1 year, and when the patient is ready, she can see the plastic surgeon to proceed with the alveolar bone grafting surgery.
Hi, I'm Dr. Paul. The plastic surgeon will perform the alveolar bone graft surgery by taking some bone from the hip to close the gap in the gum, so as to allow the orthodontist to rearrange the teeth nicely. We work closely with the orthodontist to perform this surgery around the age of 9 to 11 years.
So before the surgery, I felt a mix of emotions because on one hand, I was excited about how I would turn out after the surgery, but on the other hand, surgery is a big step and I was not sure how I would look like after the surgery and how long recovery would take. But after the surgery, I felt much more relaxed and in my own skin because ultimately the surgery did help me to boost my self-esteem and I am more confident in who I am today.
We set up the Cleft and Craniofacial Center here in KK Women's Insurance Hospital. And this was to be the de facto national center for cleft care here in Singapore. Currently, we provide treatment for almost 95% of all cleft and craniofacial patients here in Singapore. And only the surgeons and the healthcare personnel in this center have the relevant subspecialty training to manage these patients comprehensively. This being the 20th anniversary of the center, I want to say congratulations. I'm truly happy at not just how this center has grown, but has thrived over the last 20 years. And for the future, I hope that this center continues to produce doctors, nurses, and therapists who are appropriately trained in this particular subspecialty to provide comprehensive care, not just to the patients in Singapore, but around the region for many, many more years to come.